Podcast 8 of the Thorax series, The Great Vessels and Blood Supply of the Thorax. This podcast is going to bring together a couple of the earlier podcasts that detailed the blood supply to various parts of the thorax, like the thoracic wall. And it's also going to give details about the great vessels. Because of this, some of the material in this podcast can also be found in previous podcasts throughout the Thorax series. So let's start with the arterial supply of the thorax. So the aorta is the largest blood vessel in the body with a diameter of about 2.5 centimeters. It leaves the heart as the ascending aorta from the left ventricle, and it enters the superior mediastinum and curves backwards and to the left, forming the aortic arch. Coming off the aortic arch are 3 large vessels which contribute to the great vessels of the thorax. These are from right to left, the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. The brachiocephalic trunk is a short branch which ascends to the right and at the level of the sternoclavicular joint branches to give the right common carotid and right subclavian arteries. The right common carotid artery travels superiorly through the neck to supply the structures in the head and neck. The right subclavian artery travels laterally under the right clavicle to supply the right upper limb. The left common carotid and left subclavian arteries take a similar route, but travel to the left side of the head and neck and left upper limb. This arrangement of branching from the aortic arch is found in about 65% of people, but there are also some variations to this. The most common variation can be seen in about 25% of people, and this is when the left common carotid artery originates from the brachiocephalic trunk and not directly from the aortic arch. Some other variations include having no brachiocephalic trunk at all, with both common carotids and subclavian arteries coming directly off the aortic arch. Even less common is the presence of 2 brachiocephalic trunks, with each trunk giving off the common carotid and subclavian arteries. So I just want to detail the subclavian artery a little bit more. So if we follow this artery laterally, then before they pass into the axilla to supply the upper limb, both subclavian arteries give off an internal thoracic artery, and these descend down the anterior chest wall just lateral to the sternum. As the 2 internal thoracic arteries descend posterior to the 1st to 6th costal cartilages, it gives off anterior intercostal arteries which run against the costal groove of the ribs and supply the muscles and skin associated with the 6 intercostal spaces. At the 6th intercostal space, the internal thoracic arteries terminate by dividing into the musculophrenic artery and the superior epigastric arteries. The 2 musculophrenic arteries travel infralaterally along the costal margin and give off intercostal arteries as they run past the intercostal spaces. These arteries terminate by supplying the diaphragm. The superior epigastric arteries descend within the abdominal wall to supply the muscles and skin. During various pathological conditions, the superior epigastric arteries can form anastomoses with the inferior epigastric arteries, which supply the inferior portion of the anterior abdominal wall. I'll discuss the clinical significance of this in podcast 10. Now, as we have anterior intercostal arteries, we also have posterior intercostal arteries. These arteries also run along the costal groove of the ribs and are mostly derived from the posterolateral aspect of the thoracic aorta. However, the first 2 posterior intercostal arteries come from the superior intercostal artery, which is a separate branch of the subclavian. Also coming directly off the thoracic aorta are a series of unpaired esophageal arteries. There's usually 3 to 5 of these, and they supply the esophagus. There's also paired bronchial arteries that supply the bronchi, pericardial branches which supply the pericardium, and paired superior phrenic arteries which also supply the diaphragm. The venous drainage of the thorax mostly follows the same course as the arteries, with a few exceptions. The intercostal spaces are drained by either the anterior or posterior intercostal veins. The anterior intercostal veins drain into the internal thoracic veins, which run alongside the internal thoracic artery and ascend to drain into the subclavian veins. The drainage of the posterior intercostal veins is more complicated, with the left and right posterior intercostal veins draining into the azygous system of veins, which is located in the posterior mediastinum, and I first discussed this system in podcast 5. All of the right intercostal veins drain directly into the azygous vein, which runs superiorly against the right edge of the thoracic vertebra's vertebral bodies. The one exception to this arrangement is the right posterior intercostal vein, which lies in the first intercostal space and drains directly into the superior vena cava. Lying to the left of the azygous vein is the hemiazygous and accessory hemiazygous veins. The hemiazygous veins ascend against the left edge of the thoracic vertebra's vertebral bodies and receives the 9th to 12th left posterior intercostal veins. Once it has received these, it crosses the midline to join the azygous vein at the level of the 9th thoracic vertebra. The accessory hemiazygous also sits against the left edge of the thoracic vertebra's vertebral bodies and receives the 4th to 8th left posterior intercostal veins. This also crosses the midline to join the azygous vein at the level of the 7th or 8th thoracic vertebrae. The remaining 1st, 2nd and 3rd left posterior intercostal veins drain into the superior intercostal vein, and this drains directly into the left brachiocephalic vein. So the azygous vein has received venous blood from the hemiazygous and the accessory hemiazygous veins, and as it ascends along the vertebral bodies, it arches anteriorly over the right lung root and empties into the superior vena cava. The superior vena cava is formed behind the costal cartilage of the first rib on the right-hand side by the union of the left and right brachiocephalic veins, with both of these receiving venous blood from the upper limb and the head and neck. As the superior vena cava is located to the right of the sternum, the left brachiocephalic vein is twice as long as the right, and it sits anterior to the aortic arch and the origin of the left common carotid and left subclavian arteries. Both the left and right brachiocephalic veins receive the internal jugular vein and the subclavian veins behind the sternoclavicular joint. So in this podcast, I've just summarised the main arterial supply and venous drainage of the thorax. In the next podcast, I'll give details about the major autonomic nerves and somatic nerves of the thorax.